Health officials have long been worried about coronavirus patients overwhelming the medical system. Dr. Maria Simbra looked into the tough decisions that have to be made when there are too many patients and not enough resources.
When there aren't enough breathing machines to go around, how do hospitals figure out who gets them?
Nobody wants to make these decisions. And nobody wants to be in the position of having to make these decisions.
Hospitals will have to consider a number of ways to ethically provide for patients with what they have. For instance, should it be first come, first served? This takes some of the subjectivity out of it.
If the resource is available when people show up, they get it.
But it puts some latecomers at a disadvantage. How about giving them to the sickest, or to those most likely to survive, or to those with the most life years left?
And if you pour resources into someone who's not going to survive, then the worry is you may have allowed several other people to perish who might have been helped.
Should healthcare workers get them so they can help more patients?
We really need them on the line helping as many people as possible.
There are relative merits and deficiencies with all of these criteria.
There's room for legitimate disagreement about how to do that. I think there's widespread agreement that we want to treat everybody equally as far as that's possible.
The decision-making should not be up to the clinicians, but determined by the health systems.
It's a difficult process, but it's also one that is best undertaken prior to this sort of outbreak. And so health systems that have planned and that are prepared will be in a better position than those that haven't.
Other issues: how long to keep someone on a ventilator when other patients are waiting? If somebody's heart stops, do you go ahead with aggressive measures that could expose healthcare workers to infection? While we haven't hit the surge yet in our area, these are some of the dilemmas hospital ethics committees will have to grapple with. In the South Hills, I'm Dr. Maria Simbra, KDKA News.